what's kind of the discussion on improving their ability to be as best as they can be, given
Yeah.
whatever position they're playing?
Yeah, I mean, I think you can attack them in a few different avenues. Certainly, we talked about manual therapy earlier on. I think some people do need that help, to get over that hurdle. What those, dropping a dry needle in for spinatus, or doing some cupping or some Graston or something along those lines. Even just hands, ART, you name it. All those things are on the table.
Hmm.
I think positional breathing is something that's obviously low risk, and you can get some pretty high payoff for the right people. If you understand how to drive airflow just a little bit differently, I think you all right, hey, we need some IR, we're going to chase some anterior expansion. We need some ER, we're going to create some posterior expansion. Like those are things that we just start to learn. I think Bill Hartman's work is really, a difference maker in that regard if folks haven't seen it. And certainly even before that, we were exposed to PRI and a lot of things that you can, learn just by shifting people out of like a classic left AIC posture. So we'll do a lot of that. There's certainly like an element of like traditional dynamic flexibility. There may be some static stretching. There may be some capsular mobs. There may be some banded distractions. We actually did start doing, I don't even know if I would call it true yoga. We call it yoga, but it's definitely more like FRC. I don't think we stay in really static positions for an extended period of time, but every Wednesday morning, a ton of our pro guys do that. We kind of close down our cages and got a nice like little outdoor or semi-outdoor space where the guys can do that. And it's been very, very popular. So I think everything is on the table. Like I said, we have a chiropractor on staff too, if that needs to be, in play. But, certainly you got to have a lot of tools in your toolbox because no two guys are going to respond the same. And you're also going to have some guys who, unfortunately, they've got a big old bony block that isn't going to go anywhere. So you've
Yep.
got to learn how to work around it, or
Hmm.
when appropriate, refer it out and see if they're a good fit for a different kind of, intervention from someone in the sports medicine community.